Alright guys, we've got Dr. Travis McDermott here again. Today we're going to be watching dental cleaning being done. We've got Alex here who's doing our cleaning. You can see the yellowish there on the teeth is going to be the tartar, and then Aurora, our holder, is going to be holding back the gum so you can see a little bit and get a good view for things. So, general process here, we're going to go through and if there's really big calculus, which is the big chunks that are on there, we're going to chip it off with a tool that's going to knock that off, and then come through with this ultrasonic scaler that's going to go ahead and get all the little pieces off there, the particles. You can see the tube going right in the middle. So when we do dental cleanings, we put them under anesthesia. Some people will try to tell you that it can be done without anesthesia, but it is not the case. Number one, if they're not under anesthesia, we can't use an ultrasonic scaler. You can see that water being produced there, that's being kind of spit out by it. That's going to keep the tip of it cool because it's going to heat up with as fast as it's moving. If we don't have that, then we're not going to get as good of a clean. Also, as we go through, you're going to see Alex go, after he gets all these guys clean, he's going to use hand tools, basically like picks, and he's going to go through and do what we call subgingival planing, where he's going to go under and clean underneath the gums. If dogs will let you do the outside of the teeth, they will not let you do the underneath the gums while they're awake. It's just too painful and uncomfortable, and that's where all the real problem is. So you can have a nice looking mouth that's had the outside of the teeth done, but if they haven't had the subgingival work done, then it's basically cosmetic. The teeth are still diseased and will fall out if not taken care of. So you can see as he's going through, he's hopping from tooth to tooth and just getting them cleaned off real well here. So hopefully we'll show you some difference before and after. So this tartar is on there. Obviously they don't brush their teeth like we do, so that's why it's important to have them come in for dental cleanings. Other things you can do for dental health is that you can do the teeth brushing, which some dogs will allow. If they will, it's one of the best ways. If not, then other things you can do are dental chews that help keep the mouth clean, and there are some various products that you can mix in with the water that will sometimes help with slowing down the buildup of tartar. But even with that, a lot of these dogs, we're still going to recommend coming in yearly to have the teeth cleaned. This is even more so in small dogs, and out of those small dogs, even more so in flat-faced dogs like pugs, Shih Tzus, things like that, that have the conformation of their teeth not line up as well as it should, which makes them build up tartar faster. Now, when you come in for a dental cleaning, we're going to ask you some questions. Different hospitals do things differently. At our hospital, we give you some options. We do give you an option. One is going to be for blood work. Blood work's going to check the organs to make sure that they're okay. Obviously, we're going under anesthesia, so there's risks involved, but that's going to help lower the risks if we know everything's okay. There's no kidney or liver disease. Another one we're going to do is ECG. ECG is something that's going to check the rhythm of the heart. So we've all seen on TV with the little blip on the screen and the wave with the heartbeat. That's what we're going to be looking at. So that's what the ECG is going to be. And then the other thing that's very important is what are called full dental rats. So basically, just like when you go into your dentist's office, they're going to take dental x-rays of your mouth. It's going to help them assess what things look like underneath. So we'll go through and we'll probe every single one of these teeth. But without a dental x-ray, we're not going to know if there's a problem hiding underneath the surface at the root tip that might cause an abscess here in the future. So those are going to be things that we're going to recommend and we're going to make optional, but it's depending on the clinic you go to. Some require it, some don't. So that's kind of the way that we approach these, to try to make sure that we're informing you of everything that's possible. You can see the scaling hand done with the hand tool. We're going through and getting all these little nooks and crannies and crevices, and you'll also see like the cleaning of the tissue underneath the gums, and make sure that we get all the issues that are associated there, and make sure that there's no tartar buildup underneath the gums that could loosen the teeth. Interestingly enough, dogs don't usually get cavities like we do, or dental caries is what the technical term for them. They don't eat a whole lot of foods that are high in sugar. We do see them occasionally, but they're pretty rare. But more often they get what we call periodontal disease, which is more of a general class of issues that are associated with the roots and loosening of the roots through tartar. All right, so that tool that you see now is a probe that he is going through and checking every single tooth and the mouth, and is going to make sure that there's no pockets, nothing that seems like something that an abscess could form on. And like I say, we'll check every single tooth, make sure that everything's good. All right, so the final process in the entire thing is going to be going through and using the polisher to polish the teeth, and just like they do on our own teeth. So you can see the dental paste here that we're going to use, and then we're going to use the polisher to polish that in and kind of keep those teeth nice and clean, and help protect them, get all the final little, buff out the final issues with them. Once we get done with this portion of things, then we'll flip into the other side. This just kind of shows you what we do when we go through with the dental cleaning. It is very thorough. We're not just scraping some tartar off and waking them up, so there's quite a bit involved. But that's pretty much our video for today. If you have any questions, you can comment in the section below. Hope you like and share the video if you think your friends might enjoy it or learn something from it. And check us out on YouTube on the same name for the channel, Dr. Travis McDermott, Vegas Vet. Hope you guys have a great day. Talk to you later.